Thank you. Thank you very much, Chairperson, for a kind introduction. My two previous speaker had alluded regarding the glycemic control and the weight management. Now, I have a question for all of you that what drives mortality in diabetes? Is it a blood sugar? Is it a weight? And we have been taught and we are looking every time, day in, day out in our practice, the macrovascular complication and the microvascular complication. So we all are afraid. Not only we are afraid, but our patients are also afraid regarding these complications. This is a very important slide to understand cardiovascular death in India. What we are talking about India, 1 out of 4 deaths due to cardiovascular disorder. Any patient come to you with a blood sugar of 250, probably patient might be worried, you might be little worried, but at that point of time, nothing will happen. So what you need to look into it, what is the vascular issue that particular patient have? Because that drives the mortality. The CKD and heart failure are the commonest manifestation in people with type 2 diabetes, then subsequently stroke, myocardial infarction, and peripheral artery disease. Again, if you carefully look, the vascular problem underneath all this complication, it's a vascular complication, whether it is CKD, heart failure, stroke, myocardial infarction, or the PADs. There's a huge prevalence of chronic kidney disease in our setup. So 2 lakhs patients on dialysis and 4,950 dialysis center across India. So large number of the patient can be prevented. But how? If you prevent the vascular complication, that's what the microvascular complication, not the weight and not the glycemic burden. As we all know, the cardiovascular risk increases early in the natural history of type 2 diabetes. So even before the patient have high blood sugar, as we all know that, the macrovascular risk begins early in the stage pre-diabetes. This important study, the progression of early subclinical atherosclerosis PISA study. And this study shows important aspects. There's a linear correlation between blood sugar level, that is here HbA1c, and the patient percentage having a subclinical atherosclerosis at the level of carotid arteries, iliac and femoral arteries, and they have looked at coronary artery calcium score also. So every bit of rise in HbA1c level, you will have atherosclerosis. So again, a vascular issue. Risk for cardiovascular events start rising before onset of diabetes. This is again a nurse health study. 3.6-fold increase in risk of myocardial infarction, stroke before type 2 diabetes onset. These are the marker for subclinical heart failure, the cardiac troponin T, CRP, NT-proBNP, LV ejection fraction, global longitudinal strain, E by E prime ratio. Even a pre-diabetes stage, you have a raised marker for subclinical heart failure. And what we had learned from the ACCORD and advanced data, the intensive glycemic control not effective, but on the contrary, it increases the risk. So sugar control beyond certain point is not beneficial. Again, newly type 2 diagnosis, type 2 diabetes patients have a multiple risk factors. And we are talking and we will be talking in future also regarding these landmark trials, LEADER, EMPOWER-X, REWIND, SUSTAIN, CANVAS, and DECLARE. But if you carefully look at A1C data, actually, there is no robust A1C reductions were reported actually. Okay, although the baseline HbA1c were also not high, but not a robust HbA1c reductions were reported. So that's the message is that even if you're not achieving a excellent glycemic control, you are preventing cardiovascular hard endpoints. You are reducing the cardiovascular hard endpoints. And these are the data set. Most of the SGLT2 inhibitors have a positive outcome data for a MACE, CV death, hospitalization for the heart failure, hard renal endpoints, albuminuria, and all-cause mortality. And a few points were missed by GLP-1 in terms of hospitalization for the heart failure and the hard renal endpoints. Now, this slide is for my first speaker, Dr. Alkaben. Uh, Despite multiple options we have, one-fourth of the patient achieve the good glycemic control. And my first slide was that in India, 1 out of 4 deaths are attributable to cardiovascular disorder. So, do you think so? Vascular problem is bigger than the glycemic problem? Now, regarding the weight, what happens with the weight loss actually? Okay, Dr. Piyush Bhai has shown an important data set from the Look Ahead trial. We know the DPP trial also, diabetes prevention program also. We know previously very well about the surgical treatment, now the pharmacotherapy. Whatever the treatment you take, okay, at some point of the time there is a plateau. Okay, and if that person either not following the diet and exercise, then the weight will be regained. Now, the surgical aspects, whatever the surgery you have done, whether it's RUX and bypass or sleeve gastrectomy or many other, again the weight loss will be plateau and again there will be a regain. And same with the pharmacotherapy, whether it is step data or the surpass data or whatever the data you take. As soon as you stop taking the drugs, there will be weight regain happen. So you people will tell, yeah, okay, once you stop the treatment, obviously will regain the weight. But what will happen to the vascular issue actually? Yesterday, in one of the plenary session, I forget the doctor name, was a very senior doctor, and what he had shown in the last slide, once you lose the weight actually, of course you will be benefited in terms of vascular protection. That's what I'm talking. And you also know. But once you regain the weight, your vascular issue will go much higher. Okay, and he proposes, it's not proven, but he proposes the therapy that some pro-inflammations happen, and the inflammation will increase substantially once the patient gain the weight. So again the point is to prevent the vascular complication, and we have a wonderful data. I'm not going to detail. You all know that data. So vascular is the mantra to help our patients. And most of the guidelines, now this is ADA ESD consensus statement that ASCVD, risk factor, heart failure, and the CKD. That is the target. And afterwards, you have to think about the glycemic management and the weight management. So vascular protection is the most important aspects of managing type 2 diabetes. Thank you very much.